My name is Weinstein. I'm one of the nurse practitioners here at Panorama, and I'm also a certified lactation counselor. So I'd like to take a couple of minutes just to talk to you about breastfeeding, its benefits to the baby and the mom, how to help establish breastfeeding at the hospital, and also how to avoid problems in the early weeks. Breastfeeding is really the best ideal nutrition for the human brain. The human milk changes continually, and it has hundreds of bioactive compounds not found in formula. When a baby nurses, they have a decreased risk of many illnesses, including diabetes, obesity, leukemia, asthma. They have decreased risks of sudden infant death syndrome, atopic dermatitis, which is a fancy word for sensitive skin, or eczema. They have lower rates of diarrhea or gastrointestinal infections, ear infections, and they have lower rates of severe lower respiratory infections like pneumonia. There are also maternal benefits to breastfeeding. Mothers that breastfeed have lower rates of diabetes, they have lower rates of ovarian and breast cancer, and they also have decreased risk of postpartum depression. There are ways to help breastfeeding get established at the hospital. One of the most important things to do is to try to nurse your baby within the first hour of birth. Also, it's important to have lots of skin-to-skin contact early on. This way the baby can find the breast, the baby will begin to smell the mom's nipple. Nursing will just get much more easily established if you do that. Also, avoiding formula or other supplementation unless really medically indicated will help. Practice rooming in with your baby. This way you can see when your baby really has early feeding cues and nurse on demand. Trying not to use artificial pacifiers, bottle nipples, or nipple shields are also important to establish nursing. What to expect in the early weeks. Breastfed babies typically lose up to 10% of their body weight in the first few days of life. And babies that are growing well, that are breastfeeding, will want to eat frequently, up to 10 to 12 times per day. Mother's milk usually comes in on day 3. Until that time, colostrum in the breast is really enough to satisfy the nursing infant. By day 5, breastfed babies will wet 6 to 8 diapers a day and usually have 3 to 4 yellow stools per day. Ways to avoid problems in the early weeks. One thing that really makes a difference is feeding the baby early before they're crying, grimacing, and very disorganized. Early cues for feeding include stretching, mouth opening, turning their head, what we call the rooting reflex, just putting hands to their mouth, and trying to feed the baby at that time versus waiting till the baby's crying, very agitated, or their face gets very red. Once they're at that point, what we call late feeding cues, it's actually best to calm the baby down and then try to feed. Also, many moms worry that nursing is going to hurt and be uncomfortable. Really, this is a myth. Breastfeeding does not have to hurt, and really the most important thing is just getting a comfortable latch. Hopefully nurses at the hospital can help you with this, but also here at Panorama we can help you achieve that. One of the most important things is avoid holding the back of a baby's head tightly. Instead, support the base of the baby's neck, and that will allow the baby to really tip their head back properly, opening their mouth really wide to get the proper latch on the breast. This will help aid nursing and will also help your comfort while nursing. Also, changing nursing positions frequently makes a big difference. This way, different milk ducts will empty out and will also discourage any nipple tenderness. There are a few breastfeeding positions that are described here. There's the cradle hold, the football hold, the cross cradle, and also lying down. And we encourage you to try these at home, hopefully at the hospital, but we can also help you here at the office if you'd like to experiment with any of those. Also, it's very important to avoid very long nursing sessions. Most babies will have emptied the breast within 20 to 30 minutes. If a baby nurses for an hour each time, this can make nipples very tender, and it's really not necessary. In the beginning, it is important to watch that the baby is nursing well, both sucking and swallowing. Sometimes you may have to wake your baby in the early weeks. What also helps to keep them awake is, again, that skin-to-skin contact with you as a mom. Sometimes babies enjoy just non-nutritive sucking at the breast, and there's very little swallowing with that. And we just discourage that. Try, if you can, to avoid that, giving them a clean finger or something else to suck on temporarily. That will avoid lots of nipple tenderness and problems while breastfeeding. So this sums up pretty much problems with nursing. I hope that you learned something, and we really promote breastfeeding here at Panorama. We'd like to help you along. We have many qualified nurses and nurse practitioners who'd like to help you. And good luck, and we hope you try very hard to get this going.